In today's video, we're talking about something every glaucoma patient needs to know: the hidden dangers of glaucoma surgery. If you or a loved one has been told you need surgery for glaucoma, chances are you're hoping for relief, better vision, and a future without the constant worry of vision loss. But what if I told you that for some patients, the reality is the exact opposite? Imagine going into surgery expecting improvement, only to wake up with worse eyesight, unbearable pain, or even the terrifying news that the surgery failed. Sounds like a nightmare, right? Well, for some people, that nightmare becomes their reality. And here's the scariest part: most patients never see it coming. Doctors and surgeons will gladly talk about the benefits of glaucoma surgery, but what they don't always tell you: the very real risks. Risks that can leave you with infections, severe complications, multiple surgeries, and in some cases, even permanent blindness. That's why today, I'm breaking down the top 3 worst glaucoma surgery nightmares that can steal your vision, and more importantly, I'll show you exactly how to avoid them. Now, don't get me wrong, not everyone who has glaucoma surgery experiences complications. For many, it can be life-changing in a good way. But the problem is, most patients aren't properly warned about what can go wrong, and that lack of information can lead to devastating consequences. So whether you're considering surgery, recovering from one, or just want to protect your eyesight, this is information you can't afford to miss. By the end of this video, you'll know how to spot the warning signs, ask the right questions, and take charge of your recovery like a pro. But before we dive in, let me ask you something. Have you ever had a medical procedure where you felt blindsided by the risks? Maybe your doctor didn't explain everything, or you only found out the real risks after it was too late. If that's ever happened to you, drop a comment below, because trust me, you're not alone. Alright, let's get into it, starting with the first and most terrifying nightmare of all. Nightmare number 1. Losing more vision after surgery. Imagine this: you go into glaucoma surgery hopeful, expecting clearer vision, or at least a stop to further deterioration. But when you wake up, something feels wrong. Your vision isn't better. In fact, it's worse. Terrifying, right? Unfortunately, this isn't just a rare fluke, it's a nightmare some patients experience. And the worst part? Many aren't warned about it beforehand. Instead of relief, they're left wondering, what went wrong? Here's the truth. Glaucoma surgery is designed to lower eye pressure and protect the optic nerve. But sometimes, things don't go as planned. One of the biggest culprits behind post-surgical vision loss is excessive scarring. Think of your eye like a drainage system. The surgery is supposed to unclog the drain so fluid can flow properly, keeping pressure under control. But sometimes, scar tissue builds up, blocking the drain even worse than before. This can cause dangerous pressure spikes that put even more stress on the optic nerve. On the flip side, too much drainage can cause eye pressure to drop too low, a condition called hypotony. Imagine a basketball losing air and collapsing in on itself. That's what happens inside the eye when pressure gets too low, and it can lead to permanent vision damage. Then there's surgical trauma. No matter how skilled a surgeon is, working inside such a tiny, delicate organ comes with risks. And if you already have advanced glaucoma, where even a small change can push your optic nerve past the tipping point, the risk of irreversible damage is even higher. So, how do you know if you're at risk for post-surgical vision loss? Some warning signs include unstable eye pressure before surgery, which makes it harder to manage afterward. Thin corneas or pre-existing nerve damage can also make your eyes more vulnerable to sudden pressure changes. In other words, some people are already walking a tightrope, and surgery can shake that balance even more. So, what can you do to protect your vision? First, choose an experienced glaucoma specialist, not just any eye doctor. You need someone who has performed hundreds, if not thousands, of these procedures. Ask direct questions like, how will you prevent hypotony? What's your plan if excessive scarring happens? If they can't give you a clear answer, that's a red flag. Next, take post-surgery follow-ups seriously. The surgery isn't the finish line, it's just the beginning. Your doctor will need to monitor your recovery closely, adjust medications, and catch complications early. Skipping a follow-up could mean missing the warning signs of trouble. Finally, stay alert and speak up. If your vision starts fluctuating or you feel something isn't right, don't ignore it. Early detection is key. The sooner a problem is caught, the better your chances of preventing permanent damage. But just when you think vision loss is the worst possible outcome, there's an even more silent and deadly risk, a sight-stealing infection that can blind you within days. Nightmare number 2, infection and inflammation, endophthalmitis. If there's one thing that can turn a routine glaucoma surgery into a full-blown emergency, it's an infection called endophthalmitis, a severe sight-threatening inflammation inside the eye. It's one of the worst-case scenarios a patient can face, and the scariest part? By the time symptoms appear, it might already be too late. Most people assume that post-surgical infections are rare, and in a well-controlled medical environment, that's mostly true. But rare doesn't mean impossible. When bacteria find their way into the eye, whether during the surgery itself or in the delicate healing phase afterward, the consequences can be devastating. Think of it like a small cut on your skin. If left untreated, it can turn red, swell up, and even fill with pus. Now imagine that same process happening inside your eye, but at an accelerated rate. So how does this happen? The eye is an incredibly sensitive organ, and even the tiniest breach in its defenses can open the door to harmful bacteria. Infections can stem from poor surgical hygiene, contaminated tools, or even a momentary lapse in sterility during the procedure. But the operating room isn't the only risk zone. After surgery, something as simple as rubbing your eye with unclean hands, skipping antibiotic drops, or being exposed to a dirty environment can be enough to trigger an infection. And here's the real danger. Glaucoma-related infections don't creep in slowly. They spread fast. Unlike mild eye irritations that take days to worsen, endophthalmitis can escalate from slight discomfort to irreversible damage in a matter of hours. The first warning signs? Severe pain, redness, swelling, and sudden blurry vision. In more advanced cases, patients might even see pus or discharge coming from the eye, a clear sign that bacteria have taken over. So, what can you do to protect yourself? The answer is simple: prevention is everything. First, follow strict post-op hygiene. This is not the time for shortcuts. Using antibiotic eye drops as prescribed is absolutely non-negotiable. So is resisting the urge to touch or rub your eyes, no matter how itchy or irritated they feel. And here's a pro tip: always wash your hands thoroughly before applying drops or adjusting your eye shield. But it's not just about what you do. Your choice of a surgical center matters too. Not all hospitals and clinics have the same infection rates, so don't be afraid to ask questions before committing to a procedure. How often do they sterilize equipment? What's their post-surgical infection rate? A reputable facility should have strict protocols in place to minimize contamination. And finally, know when to act fast. If you notice pain, redness, discharge, or sudden vision loss, don't wait. Don't assume it's just normal post-surgical irritation. Seek medical attention immediately. In cases of endophthalmitis, even a few hours can mean the difference between saving your sight or losing it forever. Infections are terrifying, no doubt. But there's another nightmare that's just as frustrating, one that doesn't happen overnight, but creeps up on you months later. Imagine going through glaucoma surgery, only to find out it didn't work, and now, you need another operation. Sounds frustrating? That's exactly what we're diving into next. Nightmare number 3, surgery failure and the need for repeat surgeries. You've gone through glaucoma surgery, endured the recovery period, followed all the instructions, and finally thought, that's it. I'm done with this. But then months or maybe even years later, your doctor tells you that your eye pressure is creeping back up. Worse yet, they say, we might need to do another surgery. Wait, what? Another surgery? Didn't the first one fix the problem? Unfortunately, not always. One of the most frustrating realities of glaucoma surgery is that some procedures just don't last. In fact, failure isn't an exception. It's a real possibility that every patient should be prepared for. So, why does this happen? One of the biggest culprits is scar tissue. The eye, like the rest of the body, has an instinct to heal itself. It recognizes an incision or an implant as foreign and tries to seal it off by forming scar tissue. But in doing so, it can block the new drainage pathway, causing eye pressure to rise again, sometimes right back to where it started. Imagine unclogging a sink, only for new debris to build up over time. That's exactly what's happening inside the eye. Then there's implant rejection. Some glaucoma surgeries involve placing small drainage devices inside the eye to regulate fluid levels. But sometimes, the body fights against these implants, causing inflammation, scarring, and ultimately, surgical failure. And timing plays a huge role too. Some surgeries are performed too soon, before less invasive treatments have been fully explored, while others happen too late, when the damage is already beyond the point of saving. Even post-surgical pressure mismanagement can undo the entire procedure, leading to that dreaded conversation about repeat surgeries. Now, who's most at risk for this nightmare? Patients who've already had multiple eye surgeries are at the top of the list. Each procedure increases the chance of scarring and failure. Those with aggressive glaucoma, where eye pressure spikes quickly and unpredictably, are also more likely to need additional interventions. So, how do you avoid getting stuck in this never-ending cycle of repeat surgeries? First, choose the right type of surgery for your condition. Not all glaucoma surgeries are the same. Some, like trabeculectomy, work well for severe cases but have high failure rates, while newer minimally invasive glaucoma surgeries, MIGS, might be a better option for mild to moderate cases. This is why seeing a glaucoma specialist, not just a general ophthalmologist, is crucial. They'll help determine the best procedure for you. Second, don't rush into surgery unless it's truly necessary. While surgery is an important tool, other treatments, like laser therapy or medication adjustments, might buy more time or even eliminate the need for surgery altogether. Make sure you've exhausted all options before committing to an operation. And finally, post-op care is everything. The recovery phase isn't just about waiting for things to heal, it's about actively monitoring and adjusting treatments to prevent failure. That means sticking to medication schedules, attending every follow-up appointment, speaking up if something doesn't feel right. Glaucoma surgery isn't always a one-and-done deal. But here's something most doctors don't tell you: the success of your surgery isn't just in their hands. You play a huge role in how well your eyes recover. And that's exactly what we need to talk about next. Bonus tip: the one thing doctors forget to tell you. Here's something most doctors won't tell you before glaucoma surgery: the road to recovery isn't a straight line. It's more like a roller coaster. One day, your eye pressure seems stable, and the next, it's fluctuating like crazy. Your vision might even feel worse before it gets better. And that's completely normal. A lot of patients go into surgery thinking they'll wake up the next day with perfectly stabilized vision. But the reality? Healing takes time, sometimes weeks or even months. And during that time, your eyesight may go through phases of improvement, blurriness, or even temporary decline. If you don't know this ahead of time, it's easy to panic and assume something went wrong. Many patients rush back to their doctors demanding more treatments, medications, or even another surgery, when in reality, their eyes just need more time to adjust. One of the biggest mistakes patients make after surgery is overreacting to early vision changes. Picture this: you're just a few days into recovery, and suddenly, things look blurrier than before. Your first thought? Something's wrong. But what's actually happening is that your eye is still healing. Swelling is going down, fluid is stabilizing, and pressure levels are adjusting. This isn't a sign of failure, it's part of the process. Yet, because no one warns them about this, many patients jump to conclusions. They start tweaking their medications, pushing for additional procedures, or trying at-home remedies, all of which can actually make things worse. So, what's the right way to handle recovery? Stick to the plan. Follow your doctor's post-surgery instructions to the letter, even when your instincts tell you otherwise. Don't skip follow-up visits. Don't adjust your medications on your own. And don't assume that every unexpected vision change means disaster. Instead of focusing on day-to-day fluctuations, track your long-term progress. And just as important, be patient with yourself. Surgery is just step one. What really determines your success is how well you manage your recovery. That means getting enough rest, protecting your eyes from strain, yes, that means limiting screen time, and keeping up with all prescribed eye drops. And here's one last thing to remember. Don't compare your recovery to someone else's. Every eye is different. Some people bounce back within weeks, while others take months to stabilize. And guess what? That's okay. Now, speaking of taking control, there's one last thing we need to talk about. Because no matter how much we prepare for the worst, the real power lies in prevention. And if you truly want to protect your vision, here's what you need to do next. Glaucoma surgery can be life-changing, but only if it's done right. The more you understand the risks, the better you can prepare, and the more likely you are to have a successful outcome. Now you know the 3 biggest nightmares patients face after surgery: post-surgical vision loss, dangerous infections, and failed procedures. More importantly, you know exactly how to avoid them. But here's the big question: what will you do with this information? Will you walk into your next eye appointment feeling empowered, knowing exactly what questions to ask? Will you take control of your recovery, making sure you follow every post-op instruction carefully? Because at the end of the day, the success of your surgery isn't just in your doctor's hands, it's in yours too. And let's be honest, this isn't just about glaucoma surgery. It's about protecting your eye health for life. Your vision is precious, and the more you learn now, the better you can safeguard it for years to come. So tell me, have you or someone you know undergone glaucoma surgery? What was the experience like? Did anything about the recovery surprise you? Drop a comment below and share your story, because trust me, your experience might help someone else going through the same thing. And if you found this video helpful, don't forget to hit that like button, subscribe for more health content, and share this with someone who needs to hear it. The more people understand these risks, the more vision we can save. Before you go, make sure to check out the next video on your screen. It's packed with even more must-know health tips that could make a difference in your life. See you in the next one. Stay safe, and take care of your eyes.